are some problems that are specific for ultrasound. We are very close to the patient, certainly less than 2 meters of 6 feet, sometimes as close as 30 to 50 centimeters. The ultrasound rooms are typically small and very often poorly ventilated, often with no windows. The time of the examination may be long, sometimes up to 60 minutes. Patients may be asked to inhale or exhale deeply and hold his or her breath. Sometimes we perform invasive transvaginal, transrectal procedures and even therapeutic interventional procedure, which increases the risk of exposure to bodily fluid. Patients may cough, sneeze, exhale heavily, as we said. The surface of the ultrasound machine, especially the keyboard, touchscreen, and trackball, are frequently touched and can be a source of infection. So we are going to have two parts. I'm going to talk about general precautions, personal protection equipment, and how to prepare instruments, accessories, and rooms. And then Dr. Basseal will speak about cleaning and disinfection, specifically of ultrasound transducers. The first thing we must remember is that there are providers with specific health conditions, such as their age or some serious underlying medical conditions, and they should really have minimal contact with the patients, if any contact at all. Because practitioners are in close contact with patients, it is essential that they use surgical face masks when they perform the examination. Those masks, of course, must be put on before entering the patient room or the care area. If necessary, we should use respirators such as an N95 rather than a face mask when we are performing an exam that is potentially aerosol generating, particularly if we scan a patient in the intensive care unit. An important point is that very often physicians are trained in infection control, but sonographers, technicians, and some other medical personnel may not be trained, and therefore it's very important to train them and fit them for respirator when it will be required. Several rules regarding the performance of the appointment. We need to be very respectful of the appointment times because we need time between the patients to clean the room, and therefore we cannot offer to take a patient after his or her time because that will delay the others and may put and create problems in cleaning the room. So we may need to spread out the appointments a little bit. If they used to be every 30 minutes, they may now need to be every 45 minutes or whatever is convenient. Certainly in the waiting room, we need to minimize the number of patients, and we need to make sure that the seats in the waiting room are at least 2 meters apart. Patients and their caregivers should get a mask if available, and we should have no visitors in the exam room, and that includes students and trainees. This is an important point because we all are worried about training medical students, sonographers, residents, but in this time, unfortunately, we cannot allow them. Now, in some places, mine included, we are now allowing the partner of the patient, when we deal with pregnancies, to come in for a few minutes to watch the baby. But this is really something that has to be decided on a local area. And of course, if they do, they also have to follow all the rules. It's easier to assume that every patient has COVID-19, and therefore we need to clean and disinfect the equipment after each patient, and deep clean, which is a little more involved at the end of every clinic. We do this in the morning because we are not positive of how it was done in the evening. So we do it every morning before the start of the day as well as in the evening. Of course, hand hygiene is very important, needs to be done before and after every patient, and certainly if we think that we have touched infectious materials, and also before and after removing personal protective equipment. Proper hand hygiene, the easiest is warm water and soap for 20 seconds, but we also have an alcohol base hand rub near at the entrance of every single room, which that should contain 60 to 95% alcohol. And if we have a dispenser at the entrance of every room, which makes it a little easier. We should use disposable gloves during the ultrasound and of course change them between patients. If a patient is in isolation, we certainly need to use personal protective equipment prior to entering the room. This equipment needs to be properly cleaned and decontaminated if it is reusable or disposed in a special container. Surgical masks are needed when we're in close contact with patients. Of course, put them on before entering the care area. If needed, we also use reusable or disposable eye protection. We can use non-sterile gloves to perform the exam, dispose of them when leaving the room, and then again hand hygiene, and use a clean isolation room gown, potentially reusable if these are available, and those should be discarded in a dedicated container. Gowns should be prioritized to a procedure that potentially will generate aerosol. For patients that are known to be COVID-19, we absolutely need to use respiratory protection, and that means respirators rather than a surgical mask. Add to this eye protection, gloves, and gowns. As I said previously, if we know that there's a risk of aerosol generating procedure, we should definitely use a gown. And now I would allow Dr. Basseal to continue.
Thank you, Professor Abramowicz. So just to continue the presentation, in order to denature the virus, we must firstly understand its properties. Next slide, please. We have here the SARS coronavirus 2 structure, the virus being the causative agent of COVID-19. You can see a schematic overview of the virus. There are 3 immunogenic proteins sitting on the surface, and they are connected together by this fatty lipid bilayer envelope. And I'll come back to the importance of this structure a little later. The diagram here illustrates the susceptibility of different organisms, from bacterial spores right through to viruses to disinfectants. We have here on the right-hand side sterilization, high-level disinfection, intermediate-level disinfection, and low-level disinfection. And from the row down the bottom, you will note that the SARS coronavirus 2, luckily for us, being a lipid enveloped virus, much like its counterpart influenza, can be denatured by low-level disinfectants. So what agents are effective against SARS coronavirus 2? Well, we do have good news for you. Because of this lipid bilayer envelope, it is extremely easy to disrupt by most disinfectants. However, in saying that, in order for reprocessing to be successful and to denature the virus, the operator must clean before disinfecting. So cleaning is really the first and most important step in this process. In order to clean, we can use soap and water. And as Jacques mentioned, it's really important to practice routine cleaning of frequently touched surfaces. And examples of these include tables, doorknobs, light switches, desks, keyboards, and so forth. Disinfection can occur using recommended and registered disinfectants, either with the EPA or the TGA. It's really imperative to follow the instructions on the label to ensure safe and effective use. And a good example of this is the contact time or the wet time. The reason for this is the time it takes for the disinfectant to denature the organism is really essential. And this will vary from disinfectant to disinfectant. And of course, precautions, wearing gloves, good ventilation, and practicing high-end hygiene. Diluted household bleach solutions can be used, but the surfaces need to be checked. At this stage, I'd like to draw your attention to the interim guidance produced by the World Health Organization for cleaning and disinfection of environmental surfaces in the context of COVID-19. I do urge you to download these guidelines. They are on the website, they are free access. You will note that this guidance document does go through the environmental cleaning disinfectants appropriate for use, as well as the appropriate concentrations for each environment. So that's ethanol, chlorine-based products, and hydrogen peroxide. So what about ultrasound transducers? Well, ultrasound transducers are classified as a reusable medical device, and this is because it's used from patient to patient. They are very sensitive, so it is essential to use manufacturer-approved agents for the ultrasound device and to follow the IFU or the instructions for use, because failure to reprocess properly can result in the transmission of a pathogen to a patient. So how do you clean ultrasound transducers? Well, firstly, it's the most important step to start by cleaning, and this just means removing any remaining ultrasound gel that can often act as a barrier to the disinfectant and therefore diminish its efficacy. To do this, you can remove the gel from the ultrasound transducer by wiping it down, washing the transducer with detergent and water. At this stage, if required, you may use a soft brush, and of course drying the transducer, which is really important because residual water can dilute the chemical disinfectants. So after cleaning the ultrasound transducer, you are now ready for disinfection. The sporting classification system is a system designed to classify medical devices according to the risk. So non-critical ultrasound transducers are classified as low risk. They are transducers that are used externally and in contact with intact skin. Examples include transducers for transabdominal scanning, musculoskeletal, and general ultrasound. Semi-critical devices are those used externally or internally and in contact with blood or bodily fluids, mucous membranes, and open wounds. And examples would be those used for transvaginal and transrectal. And of course, critical or high risk are those used for intraoperative procedures. So what is the COVID-19 specific guidance for non-critical transducers? As mentioned before, clean the transducer first and then go ahead and use a approved low-level disinfectant. And yes, this will denature the virus. It's very important to use agents that are approved for ultrasound transducers, and there are numerous products out there, including wipe systems. The COVID-19 guidance for semi-critical transducers. Firstly, an improved single-use transducer cover must be used for these procedures. Again, remove the transducer cover, clean, then use a high-level disinfectant, and only use approved high-level disinfectants for ultrasound transducers and adhere to the instructions for use. Now, this really is normal practice. There is no change in the context of COVID-19 for high-level disinfection. Given the short duration of the webinar, we would like to draw your attention to more information online. Please do have a look at the World Federation for Ultrasound and Medicine Biology position statement on cleaning and disinfection. They are excellent guidance documents. They are in detail. They have been approved and they are free access. So do download them and go through it in detail. And on that note, we would both like to thank you for your time and for tuning in. We'd like to remind you to keep calm, to wash your hands, and don't forget to wash your ultrasound transducer. Thank you very much.